I'm a dialysis patient. I died 3 times a week. The cost of my medication is really too screaming high. Sometimes I can't get them because it be too high. It make you feel depressed now. Well, one day I was just sitting on the bed and I was thinking, how is I'm gonna get this medicine? And I just called and I asked them, how can I get some more help?
So when I learned that Miss Wanda was not able to fulfill her prescription, I became concerned. The main priority is how can we get this medication to her as quickly as possible so that she can get her condition treated.
She was enrolled in Monogram's program for CKD, but this is a COPD-related intervention that, if not addressed, would have ended up putting her in the hospital. Her symptoms would have worsened. She would have experienced more and more shortness of breath, which would have resulted in an ER visit, an inpatient admission to continue dialysis.
Monogram Health and Monogram Health First were able to collaborate with the pharmacy team. Pharmacy was able to find an alternative medicine that was much more affordable.
Sometimes the only barrier to obtaining these medications is that they're prohibitively costly.
They got right on it quick. It wasn't a day that went by. They got on it real good for me.
What happened for Wanda is the primary way that a pharmacist can get involved, and that is looking at therapeutically equivalent drugs that, based on a patient's insurance coverage, are going to work just as well for the patient, but just be much more affordable. So in this case, it was COPD maintenance inhalers. They are then told that's gonna be $400. Our pharmacist was able to look at her plan and say, okay, this drug isn't covered, but this drug is covered. In addition to switching the medication, we were also able to find discount cards to make even that prescription more affordable, and then confirm with Wanda, yes, it was only $55, and we're able to make that work.
So it minimized complications for her, and it allowed her to stay home safely.
It really did. Like I said, it made my day. It took a lift off my heart. So when you have to do everything by yourself, you know, it'd be a strain. But be able to call Monogram, it made me feel real good.
The nice thing about Monogram Health First is that it's accessible 24/7. So if a patient runs into a problem, they can call Monogram Health First and have access to a nurse that can be escalated to a doctor. It can be escalated to other disciplines to help address things quickly.
They care a lot about you because they call you and ask you, do you need anything? Is you all right? And I like that. And I really appreciate Monogram.
In Ms. Wanda's case, Monogram's approach went beyond just clinical care by having the other disciplines reach out and help her navigate the system. It was problem solving at its best.
That's the tremendous value of Monogram Health First, is allowing us to close gaps in care for patients like Wanda.
Personalized care means to me that you meet the patient where they are. Monogram was able to close the gap by making sure she got the medicine. But going forward, we're going to continue to monitor, see if she has new needs, new medications, new barriers.
I will continue to call Monogram at all times when I need it. It feels like family, that someone cares about you.
Better care, delivered faster, and right at home, so patients like Wanda can stay safe, comfortable, and out of the hospital.